Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us is the Minister of Health, Tyler Shandro, as well as Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Minister Shandro will provide a brief update, followed by Dr. Hinshaw.
Thank you, Tom. Good afternoon. Today is an important day for our province. Today, I'm pleased to announce that the state of public health emergency will lapse in Alberta. We've come a long way since the state of emergency was declared on March 15th. I know that these past few months have been challenging for all Albertans, families, and communities. We've all had to make sacrifices and adapt to a new normal as we work to limit the spread of COVID and keep our health system from being overwhelmed. We faced an enormous test, and our province passed with flying colors. Albertans met this challenge the same way that we meet every task. We took it seriously, and we did the right thing. And we continue to do it. As Minister of Health, I'm thankful to have had Dr. Hinshaw with us to help guide us through these extraordinary times. Declaring a public health emergency gave us tools that we needed to ensure that we could respond to the pandemic and prevent the spread of infection throughout the province. This played a small but vital role in our response over the last 3 months. For example, it provided additional authority, which helped AHS support long-term care facilities, and it provided authority to health inspectors for them to enter any area of an airport to ensure compliance with public health measures such as cleaning and physical distancing. However, due to the remarkable success of our province, the vast majority of our emergency measures were taken under the regular authority of the Public Health Act. As we entered stage 2 of the provincial relaunch, the state of emergency is no longer needed to protect Albertans. Now, I want to be clear. While the state of emergency is lapsing, it does not remove or impact the existing orders that Dr. Hinshaw has put in place, nor does it impact her ability to issue additional orders as they may be needed in the days ahead. All ministerial orders amending legislation made under Section 52.1 continue for a period of 60 days unless they are terminated sooner. Now, while the public health emergency formally expires today, COVID is still with us, and we must all still remain vigilant. And as we must still be prepared to respond if we see a significant increase in cases throughout our province. And now, to that end, we'll introduce legislation later this week to ensure that we have the power to respond to the pandemic as it's needed. I'll have more to say on this important piece of legislation after we table it in the legislature. We've come a long way, but the fight against COVID is not yet over. Our government will still continue to make sure that we have the right tools available to keep Albertans safe as we continue moving forward as a province. And I'm pleased to say that more than 9 million masks have been distributed to Albertans from drive-through restaurants in just 1 week. And another 2.3 million masks have been shipped to partners including 44 municipalities, 46 First Nations, 7 of our Métis settlements, 1,106 seniors organizations, 107 shelters, and 75 addiction treatment facilities. Masks continue to be available free of charge across the province, and I urge all Albertans who haven't already done so to get them from a McDonald's, Tim Hortons, or A&W drive-thru. Alberta remains the only province in Canada distributing non-medical masks to their residents. We're going the extra mile as a government, but we're all still each other's best defense against the virus. We all still need to follow the public health guidelines that Dr. Hinshaw has put in place. Albertans have always been committed to helping out our friends and neighbors. That commitment has brought us through the last few months better than most other jurisdictions around the world and allowed us to proceed to stage 2 of our relaunch strategy here in Alberta. Now, thank you for your continued hard work and for your vigilance. I'd now like to invite Dr. Hinshaw to provide today's update of COVID-19. Dr. Hinshaw.
Thank you, Minister, and good afternoon. I am pleased to report today that 6,862 Albertans have recovered from COVID-19, leaving 440 active cases in the province. Currently, 31 people are hospitalized with COVID-19 with 7 of these in ICUs. In the last 24 hours, we unfortunately have confirmed 1 additional COVID-19 death in the province. This brings the total number of lives lost to 151. My condolences go out to the family and friends of this individual and all those who have lost loved ones during this time. We have now completed more than 343,000 tests. Out of 3,462 tests completed, there were 20 new cases. I know some people are wondering when we will stop identifying new cases. The reality is that the more you test, the more cases you're likely to find. It is a good thing to find cases, and Alberta continues to test more broadly than any jurisdiction in Canada. We are responding swiftly every time a new case is identified. I want to recognize the many public health professionals who continue to work around the clock to support our COVID-19 response. This weekend, as we began Stage 2, I also appreciate the efforts of Albertans who were conscientious in respecting gathering limits, maintaining a 2-meter distance, wearing masks when you couldn't, practicing good hygiene, and staying home if you were feeling sick. I know that many people were excited to visit restaurants, get their nails done, attend fitness classes or sports, and participate in worship services. And many businesses were relieved to be able to safely resume operations. As Albertans go out more, while our collective efforts can and will reduce the spread of infection, we can also expect to see some increase in cases around Alberta. To help prevent local outbreaks and help you make informed decisions, you can view a relaunch map to see where active case rates are at in different municipalities in the province. If a local municipal district has 50 active cases per 100,000 population with at least 10 active cases, we move it into the watch category. This simply means that public health will work with local public health officials and municipal officials to see if we need to implement additional measures to prevent spread. As of today, there are 2 municipal districts in this category, but no additional measures are needed at this time in either of these districts. We do continue to monitor the situation closely. It is important to remember that this threshold of 50 active cases per 100,000 population is simply 1 point on a spectrum of local risk. While this metric helps provide transparency to the process of determining any need for extra local measures, in areas below that threshold, we still need to continue our precautions. In Edmonton, for example, we have seen an increase in active cases over the past 2 weeks. We now have 167 active cases in this city, which is approaching the level of Calgary's 194 active cases. We must remain watchful in protecting each other. Our health system is still prepared, and our rates of hospitalization and ICU admissions for COVID-19 remain well within our capacity in Alberta. In our Edmonton cases, 2/3 of these active cases are linked to having close contact with a case of COVID-19 or being part of an outbreak. 1/3 of the active cases remain under investigation. What we know from the patterns we are seeing in the transmission is that social events where people are not keeping 2 meters distant or wearing masks are high-risk activities. We are not seeing patterns of spread at this point linked to casual contact or public places. I want to reiterate that the people who are part of this active case number list are doing the right thing by being tested and staying home to stop further spread. The success of our relaunch is anchored in all of us doing our part, and the measures in place will get us there. The actions each one of us takes every day will help protect our friends, our families, and our neighbors, especially those most at risk of severe outcomes from COVID-19. No event, community, or region of the province is immune from the virus. That is why it is critical that each one of us takes pride in what we can do every day to protect those around us. I encourage you to go for testing. Testing broadly helps us understand where we have cases and if we need to take additional measures in a regional area or make changes to our relaunch strategy. Booking a test is easily done online at the AHS website. If you have a disability that might make it difficult to go for testing, please call 811 to find out more about other options to access testing. From our weekly report on asymptomatic testing in the province, I can tell you that an additional 11,341 asymptomatic people who had no known COVID-19 exposure were tested last week as a part of our broad population monitoring goal. We identified 4 additional COVID cases in this group. I want to thank all those who have participated in this testing and encourage more people to go for testing this week. Testing broadly helps us understand where COVID may be circulating in the province. While testing is open to all Albertans, it is particularly important that anyone with symptoms or who has a known exposure to COVID-19 go for a test. In the past week, we have done 300 tests on asymptomatic close contacts of confirmed cases, with 41 new cases identified in that group. This highlights why it is so critical that close contacts of cases stay in self-isolation for 14 days, even if they are feeling well. It also underscores why we ask close contacts and anyone in an outbreak setting to be tested promptly as a part of our outbreak control measures. Unfortunately, even with all these efforts, although many sectors are opening back up, there are still many Albertans who are unable to resume activities similar to how they operated pre-COVID-19. I encourage Albertans to continue to look for other ways they can support friends and family who are at higher risk of severe outcomes if they should contract the virus. We are all hardwired for social connection and need this connection to stay healthy. Let's keep thinking of all the ways we can connect while we also prevent transmission. For example, one inspiring post from the Alberta Cares hashtag this past weekend highlighted volunteers who delivered what they called positivity pots, 10 uniquely decorated flower pots filled with various flowering plants to brighten residents' rooms at the Bethany Care Society Continuing Care Facility in Airdrie. This is just one example of how we can show our loved ones how much we care for them. We are getting through this together, and we must continue to protect and support each other in the days ahead. This is a marathon, and we are not yet near the end, so let's pace ourselves, encourage each other, and cheer each other on with face masks in place. Thank you, and we will be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
First question is Helen Pike with CBC. Go ahead, Helen.
Hi, Dr. Hinshaw. I know that you have spoken about this before, but I just kind of wanted to get it all in one place. Things are opening up, obviously, and cohorts and all of that. The language in early days was very family-focused. And I've spoken to some Albertans who live alone, who are single, who've had their whole kind of, you know, you're talking about social connection. They've had their whole social lives turned on their heads or ear or what have you. As things are opening up, you know, talking about dating, talking about seeing other single people who don't have families, what is your advice right now?
So thank you, and certainly I heard that same feedback, that the cohort family model was really focused on those, again, who had children still at home. So whether it be older people or younger people who were not in that situation, it didn't necessarily create opportunities for them. What we've done with stage 2 is we've looked at an expansion of that cohort. And so what we've called that household cohort, we're working on some refinements, but right now what we're looking at is to be clear that it would be, you would be able to be in a cohort, so people that you would be able to be in closer connection with and spend time with, up to 15 people outside of your household. So that's a bit of a refinement from previous, but what we're looking at is that those, for example, someone who's single who wants to be able to spend time with friends, if a group of friends, up to 15 people, again, outside of a person's household, want to be able to spend time together, that you would really keep it within that group, because we know that social interactions, as I mentioned earlier, do bring a higher risk of spread of the virus. And so you want to try to keep that group closed. Those are the people that you're interacting with in a way that perhaps you don't have to stay 2 meters distant from each other at all times, but you want to keep that as one group. So not necessarily have that group then overlap with multiple others, because you're trying to, if there is transmission within that group, that it wouldn't then spread to multiple others. So again, I recognize that those who are single, who are not in families, and again, whatever their age, this has been a very difficult time. And so we're, again, using this cohort model to try to limit the total number of people who might be exposed in any one gathering.
Operator, can you put through the next question, please?
Next is Dean Bennett with the Canadian Press. Go ahead, Dean.
Thanks. Question for Dr. Hinshaw, maybe for the minister as well. What can you tell us about the reports we're seeing about perhaps Americans on their way to Alaska are actually staying over in Banff? Is there a concern? What are you seeing statistically, anecdotally? Is there a problem? And if so, what can be done about it?
So I'll maybe start, and then I don't know if the minister wants to add to that, but I have seen media reports of at least one case where that happened. We do know that it is possible for people who are driving to their home in Alaska to be able to cross the U.S. border. And we have been in contact with I have been in contact with the Canadian Public Health Agency of Canada, and through them, the Canadian Border Services Agency, about a concern with respect to making sure that when people do cross on their way to Alaska, that they're very clear about the requirements. As I mentioned, I have seen one media story about perhaps one particular group that came through and maybe didn't share accurate information. So I'll be following up with a conversation with my counterparts at the Public Health Agency of Canada. But at least the information I have, I don't have information to indicate this is a significant number of people crossing the border. So that would be my comment. I don't know, Minister. Okay.
All right, we'll go to the next question, please. Operator, could you put them through?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
As we've seen an increase in the number of active cases for a whole week, but we are going with the lifting of the restrictions and the end of the emergency state in Alberta, how confident do you feel that we will still go down in the long term, even though we're seeing an uptick right now in the cases?
We know that when we move into reopening places for Albertans to be together, to socialize, to be in different workspaces, that there will be some increase in cases. What's really important is that we keep the number of cases within our ability to manage, so our contact tracers are able to manage, that we're able to manage within our hospital and ICU capacity. And I think it's also really important for Albertans to remember that we're all in this together, as I've said before. And so I do believe what we've seen over the past week is, again, the results of the moving back into perhaps more of a normal life and maybe forgetting the additional public health measures that are needed. But we will be working to continue to remind Albertans that wherever they go, they need to be moving into the new normal, and encouraging Albertans to remember that we have to protect each other, that we are each other's best protection. And so I'm confident that Albertans collectively can continue to hold our numbers steady and not see a sharp, dramatic increase. But we will be watching, and if numbers do go up rapidly and dramatically, if we do see an increase that starts to threaten our ability to respond, whether it's through our contact tracers or if we do see rapid increases in hospitalization rates, we'll have to consider whether or not additional measures are needed. I believe that Albertans want to be able to do two things. They want to be able to interact more, have more of the life that they used to have. And I also believe Albertans want to protect each other. And so I think we can have both things as long as we continue to remember that the public health measures that are in place are a part of our ability to successfully move through relaunch and keep these new activities and businesses open.
Operator, can you put through the next question, please?
Next is Phil Heidenreich with Global News. Go ahead, Phil.
Hi, Dr. Hinshaw. It's a two-part question, following up on a question you were asked a few weeks ago. But last week, the Alberta Energy Regulator reiterated its position that because of your public health requirements, they had to lift environmental monitoring requirements for the oil and gas sector. And so I'm just wondering why that line of work is so dangerous in the pandemic. And I'm also wondering, in terms of monitoring of fumes from burning, whether that creates a risk for people who are susceptible to COVID-19.
So the general guidance that we've put out that's applicable to all settings would be our guidance available on the BizConnect and on the Relaunch website. And we have asked each sector, each business, each industry to look at the guidance and determine how it applies in their particular context. And so decisions made about the application of that would be up to those particular organizations. So that decision with the Alberta Energy Regulator is not one that I was specifically involved in. That would be, I guess, their interpretation of the general guidance that we've put out. With respect to monitoring fumes, again, I think it would depend. I know a lot of the monitoring that's done with respect to air quality is done with pre-positioned monitors. So there are monitors in place across the province that continually measure the air quality and different levels of contaminants in the air. So there would be no exposure necessarily to a person unless there was need to do maintenance or some kind of work on those stations. So again, I think it would depend on the task of the person who was involved in that monitoring. With respect to the safety of those individuals, it would be up to the organization that is employing them to make sure that all hazards were identified and that those employees were being kept safe.
And I would just also add that AER is an independent body. It's their interpretation of the guidance that Dr. Hinshaw has provided the province. But my understanding also is that the decision was with respect to a reporting, not monitoring, that the monitoring is still occurring, but that there was relaxation that AER has provided for reporting only. So anyways, just wanted to make that clarification. But I think there was a second part to the question as well. Tom, is that also for Dr. Hinshaw?
I believe it's the fumes.
Oh, that was the fumes, so they both answered? Okay. Well,
Operator, can you patch through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. You've previously recommended masks be worn when you can't physically distance. Now some doctors from Edmonton and Calgary are calling for masks to be mandatory when you're in public, even if you are able to physically distance. There's also new research published in the Proceedings of the National Academy of Sciences and the Lancet about how masks in public can prevent transmission of the virus. So with growing calls from doctors for more stringent mask protocols and more research suggesting masks are effective in reducing spread, what needs to happen for masks to become mandatory in Alberta? And if not, could you again explain how come masks shouldn't be mandatory?
Thank you. We are closely watching the development of evidence on this topic, and with respect to the wearing of masks in public, we certainly have been encouraging all Albertans to wear masks. Certainly when some people when it's sometimes difficult to predict if you're going out in public where you may or may not be able to keep 2 meters physically distant. So it would be prudent if people are going out into a place such as a grocery store or going into any kind of a gathering or a public place. If you're not sure whether or not you can keep 2 meters distant, it's best to err on the side of caution and wear a mask. Masks have been provided free of charge, as the minister mentioned, and so all Albertans have access to masks and can go to A&W, Tim Hortons, McDonald's to pick up masks, or they're also being distributed in transit stations by calling 211 or through other means. So really all Albertans have access to be able to wear masks. And with respect to making them mandatory, we are looking at the evidence, as I mentioned. We're looking at evidence that from the World Health Organization new statement on masks, as well as the publications that you mentioned. What we're wanting to do is make sure that Albertans know what the evidence is, they know our recommendations, and they have every ability through the provision of masks to be able to put that into action. Before we made any kind of public health measure mandatory, we would need to carefully consider the pros and cons of that and any potential unintended consequences. And so right now what we're doing is really encouraging Albertans to wear masks in public places, particularly if they're going to be in a space where there's many people together. And again, really encourage Albertans to go and pick up the masks that are being made available to them so that they can take this important public health measure.
Operator, can you put through the next question, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Can you please provide an update on cases among the younger population that you talked about last week? And I'm wondering, is it your view that younger people have been taking less precautions than the older population?
So I don't have an update from the information I shared on Friday, which was about at that point, the 60% of our active cases were in individuals less than 40. We can look at the cases over the weekend, but I don't have that case breakdown by age in front of me right now. What seems to be at least what we're seeing with respect to spread, and when we're doing our case follow-up of cases, it does seem to be often in social settings where there is transmission. And we're therefore encouraging all Albertans, but particularly people in that younger group, to make sure they're thinking about the measures they need to put in place, limiting their close contact with others. I know that the last few months have been very difficult. And as was mentioned earlier, some of the ability that we had structured for people to gather in settings with others was focused on families. And so there may be younger people who are single or living alone, or perhaps not in a family setting, where being able to be together with friends again is what they crave. And that's completely normal. I just want to make sure that younger Albertans remember that what we all need to do is protect each other, and that while those who are younger, who have no chronic medical conditions, may be at lower risk of severe outcomes, if someone gets infected and passes the virus on to someone else, you can be a part of a chain of transmission that can have tragic consequences. So please remember, when you're making decisions who you're protecting, think about the loved ones in your life who are older, or who have chronic medical conditions, and interact with others the way you would want those loved ones to be protected. Because that's, again, we're all in this together. We have to protect each other because we are all that we have to make sure that the transmission of the virus stays low.
All right, we've got time for 2 more questions. Operator, could you put through the next one, please?
Next is Dylan Short with Post Media. Go ahead, Dylan.
Hi, Dr. Hinshaw. You've spoken about this a little bit already, but I was just wondering, with the increase in Edmonton that we've seen, how much of this do we attribute just to that reopening? And you mentioned that there were going to be more numbers as you reopen. And how much of it do we attribute that this is more of an issue than just the reopening and increased numbers? And then secondly, at what point do we start to worry that there's maybe a second wave coming to the city?
The increased numbers that we're seeing in Edmonton, again, the dominant number of them, so about 2/3, really seem to be linked to these close contacts of confirmed cases, known outbreaks, and it does seem to be linked to these social interactions. So I would say that started before our phase 2 started of our relaunch, and is likely due to people feeling that COVID is at an end. I think there's a possible perception that with our first wave coming down and being low, that it may feel like this is over, that our response is over and we can go back to life as normal. And so I think it's important, again, that people remember that this virus is going to be with us for many months to come. We need to continue being cautious and protecting each other. And I don't think that this is entirely due to relaunch. Again, I think it's due partly to people really just needing to have social interaction, and unfortunately sometimes forgetting that need to be cautious during that social interaction. With respect to a second wave, I think it's very likely that we will see some kind of a second wave. The timing and the peak of that wave are entirely dependent on us. This is in all of our hands with respect to the spread of the virus. We've seen that in some places in the United States, in some states where they've moved into their relaunch and reopening, they have seen some significant increases in cases even in the summer. So we cannot trust the summer or a seasonal attenuation to prevent the spread of the virus by itself. We have to make sure that we're being cautious, and each one of us taking pride in our ability to protect each other is what's going to help keep any kind of a second wave very low and manageable, and try to spread it out as much as possible so we don't have a high peak.
All right, operator, could you put through the final question, please?
Final question is Susan Imergen. My apologies, from CTV. Go ahead, Susan.
All good. Susan Amarongan here from CTV. Thanks for taking my call, Dr. Hinshaw. Just wondered, you sent out a tweet about increased alcohol and cannabis sales. I think it was yesterday. I'm just wondering if you can elaborate on why you sent that out, and are you concerned that people are dealing with the stress of the pandemic using alcohol and marijuana?
What we've seen through both the survey data with responses from Canadians indicating that many of them had been, if those that drink alcohol have been drinking more frequently during the pandemic time, but also with some of the sales numbers from AGLC indicating an increase in sales during the last few months when there's been a shutdown. There are concerns that perhaps increased consumption of these kinds of substances like alcohol or cannabis could potentially set people up for challenges as we start opening back up. People are needing to move back into more regular rhythms again with public health measures. But I think one of the important things to consider is that if people did start either using alcohol, cannabis, or other substances more during the last few months of closure, that there's help available if people are finding it difficult to slow down or cut down their use of those substances. And that was why I wanted to make it really clear that there is that help available, 24/7 helplines, lots of different services available across the province, because it's really critical that people know that they can reach out, that they're not alone, and that there are people there to help them.
Thank you all for joining us. Dr. Hinshaw will provide another update on Wednesday afternoon.